Welcome back, everybody. This is Dr. Aaron with the Chiropractic Place here in Redding, California. We are doing our three-part series on the spine, trying to explain so that people can understand why the spine is so important, why chiropractors are so passionate and adamant about making sure that their patients have their spine checked on a regular basis. Last week, we did a video about the neck and all of the areas of your body that are regulated from the nerves that come out of your neck. And this week we're going to talk about chiropractic care and the mid-back. So we have 12 bones in our mid-back, what we call T1 through T12. So these bones have nerves that exit out at every spinal level, and it's helpful for people to understand where do those nerves go, what do those nerves control and regulate, because our nerve system controls and regulates everything our body does. And our spine is the armor that protects our nerve system, keeps it safe. So when chiropractors introduce a chiropractic adjustment to your spine, what they're trying to do is restore motion, get that spine moving properly so we can take pressure off your nerve system so your nerve system can govern your body properly. Let's take a look at these areas. So here at T1, we have nerves that go to our arms, control wrists, elbows, shoulders. We have nerves that control the trachea for breathing, control the esophagus, which helps us swallow. At T2, we have nerves that come out of this area that go to the heart and to the coronary arteries. Those are the blood vessels that supply the heart muscle. When people have heart attacks, it's really common that the coronary arteries have plaque. So having proper nerve flow to these areas of your body can help improve your health and improve the function of what goes on there. So at T3, lungs, chest, and the breast tissue. Really good for people who struggle with asthma to have this area of their upper back adjusted regularly, because the nerves from this area can help open the bronchi of the lungs, which is what is affected when you're having an asthma attack. The bronchi constrict and it's hard for air to get in there. So having these areas checked when you're an asthmatic can be very helpful to keep the bronchi open and functioning properly. T4 goes to the gallbladder, right? The gallbladder helps us digest and emulsify fat in our diet. It's a very important organ for us. Very helpful to have this area looked at. T5, this one goes to the stomach, to the liver, to our solar plexus. T6 goes to the stomach, people having reflux issues, maybe digestive discomfort. This is a great thing to have them analyzed in their mid-back because, again, stomach here, we have stomach here. At T7, it goes to our pancreas. Our pancreas helps produce insulin, digestive enzymes that help us break our food down. It goes to the duodenum, which is part of our small intestine, where after food goes to our stomach, it enters into the duodenum and further digestion occurs. So having these things function properly helps us take in nutrients properly. T8 goes to our spleen. T9 to the adrenal glands. A lot of things people have heard about today, adrenal fatigue. They're constantly in a stress state. So having that T9 checked can sometimes help balance what's going on with the adrenal glands and keep them functioning at their best level when they're going through times of stress. T10 controls our kidneys, right? Our kidneys filter our blood. They play a big role in blood pressure and making sure filtering out toxins and impurities. Kidneys and ureters at T11 and T12, we get innervation to and nerve flow and nerve supply to our small intestines and to some of our part of our lymphatic system, which helps circulate our immune system throughout our body. So you can see here, that's a lot of information we just covered, and that's just one region of the body. That's just the mid-back. We still have the neck that we talked about last week. We have the low back and pelvis, which we'll touch on next week. But man, what a lot of things that are controlled by these nerves that come out of your mid-back. So you can see why when you go to your chiropractor, you may not experience pain in your mid-back. But why, hey, why is my chiropractor adjusting my mid-back if my pain is in my low back? It's because your chiropractor, number one, wants to be thorough And number two, when they're providing your chiropractic care, it's not based on your symptoms. We are looking for areas where there's dysfunction. Maybe you have pain there, maybe you don't. But you do have nerve flow that comes out of these areas 100% of the time. So my job as a chiropractor is to make sure that that spine is functioning properly, regardless if you have pain, so that your nerve system can govern your body at 100%. I'm Dr. Aaron Seaton with the Chiropractic Place. Stay tuned for next week. We'll do a video on chiropractic and the low back.